Hello, I'm Dr. Carlo Carandang, and I'm a psychiatrist with AnxietyBoss.com. Today, I will talk about panic disorder. So panic disorder is an anxiety disorder where you have repeating panic attacks and you have extreme fear of the next attack coming. So the audience will benefit from this presentation by learning more about panic disorder and how it can be treated. So here are some facts about panic disorder. The lifetime prevalence of panic disorder in the population is 5%. Those at increased risk for developing panic disorder include women, middle age, low-income earners, and people who are widowed, separated, or divorced. Panic disorder also runs in families and is moderately heritable. So here are some of the symptoms of panic disorder. Panic disorder is characterized by recurrent panic attacks which are random and have abrupt onset. A panic attack is a period of intense fear and it interferes with your functioning. And this is followed by persistent concern about having another panic attack, which is also known as anticipatory anxiety. So let's define panic attacks. Panic attacks are characterized by palpitations, where you could feel your heart pounding, or you might have chest pain. You might also have sweating, chills, or hot flushes. You might have trembling or shaking. You may have sensations of shortness of breath, or you may feel like you are choking. You might feel that you are dizzy, lightheaded, or you feel like you're going to faint. You may also have the fear of losing control, dying, or fear of going crazy. So when you have these panic attacks, they generally last from between 5 to 15 minutes, and then they go away. If you have a panic attack that lasts for hours or all day, then it's probably not a panic attack. It's something else, like an anxiety attack, which is triggered by something else. So panic attacks are spontaneous episodes which occur abruptly and peak out at between 5 to 10 minutes, 5 to 15 minutes. So anything that lasts longer than that, like hours or an attack that lasts all day, is most likely not a panic attack. So how do you make the diagnosis of panic disorder? Well, panic disorder is characterized by recurrent panic attacks which can occur throughout the day, and it can occur several times per week. And you also have avoidance of places or situations for fear of having a panic attack there. And it's these symptoms of panic attacks and avoidance which interfere with your life and disrupt your functioning. So these symptoms have to be present for at least 1 month for the diagnosis of panic disorder. So what's the clinical course of panic disorder? Well, in women, panic disorder tends to occur in early adulthood. So in women, it tends to start in the mid-20s to the mid-30s, while in men, it tends to occur later. So in men, panic disorder tends to occur in their 30s to their mid-40s. Panic disorder also has a high relapse rate and is chronic. So in other words, panic disorder lasts a long time. And even if you don't get panic attacks for a while, they most likely come back without treatment. And as panic disorder progresses, agoraphobia may develop, which is a fear of places or situations where escape or help may be difficult in the event of having another panic attack. So when you have panic disorder and it goes on untreated, what happens is that it can progress, get worse to the point where you develop agoraphobia in addition to your panic disorder. So people who have developed agoraphobia with their panic disorder, what happens is that they start to be homebound because they have a fear of going out into places or situations where they may not get help, as they are fearful that they may have a panic attack in those situations. So that is that when you get agoraphobia, it severely limits your functioning, as those folks are generally homebound and therefore cannot go to work. They don't interact with family and friends. So when you get agoraphobia, it is a sign that it's severe. It's a sign that the panic disorder has progressed severely and you need help. So I often get the question from people who have panic disorder about why panic attacks seem to come out of nowhere when they have panic disorder. Well, the unprovoked panic attacks are caused by a malfunctioning in the fear circuit based in the amygdala in your brain. So this fear circuit malfunctions on an intermittent, unexpected, and catastrophic manner, which leads to the panic attacks. So the reason that you're having unprovoked panic attacks is that your fear circuit is malfunctioning, and it malfunctions in bursts. So unexpectedly in bursts. So therefore you can get the panic attacks while you're sitting doing nothing, or you may get panic attacks when you're lying in bed sleeping, so the panic attack can wake you from sleep. So this is why the panic attacks seem to come out of nowhere, and that your fear circuit malfunctions on an intermittent, unexpected, and catastrophic manner. So this is the reason. It's based on a malfunctioning fear circuit in your brain. So what exacerbates this is that what's exacerbating this malfunction in your fear circuit is that there's also ongoing activation of the worry circuit, which is located on the corticostriatal thalamic cortical circuit. So that's the CSTC circuit in your brain. So what happens is that these worry circuits then, the worry circuit then feeds on these malfunctions, which tend to kindle the ongoing problems with your fear circuits and hence your panic attacks. So the intermittent and catastrophic malfunctioning of the fear circuit leading to unexpected panic attacks is exacerbated and perpetuated by the malfunctioning in the worry circuit, where you are having anticipatory anxiety about when the next panic attack will occur. So worrying about the next panic attack only serves to kindle future panic attacks. So this is why you have to address both the unexpected panic attacks with treatments such as medications, and you also have to address the worrying about the next panic attack occurring through treatments such as cognitive behavioral therapy, which I will discuss later in this presentation. So let's talk about the worry circuit, about how your worry about the next panic attack occurring and your avoidance of situations which may induce panic attacks actually serves to maintain and worsen your panic disorder. So here we have what's called a negative cycle of panic disorder. So let's say your trigger is you're having physical sensation of anxiety, where you're having increased heart rate, palpitation, and chest pains. So this situation that's associated with the chest pains induces thoughts about what's happening. So you may think, I am having a heart attack from the chest pains. So these thoughts then induce anxiety. So you get anxious, you're terrified, and then this is also associated with further physical sensations of the adrenaline response, where you have increased heart rate, you have tremors, you have lump in the throat, you have butterflies in the stomach. So, and your muscles are tense, so you might be breathing faster. So this anxiety then makes you avoid. So you may then try to escape the situation, and you try to avoid the triggers. However, this avoidance maintains the belief that you are having a heart attack, and what this does then is that this maintains this negative cycle, and this further develops your panic disorder. So one of the parts of treatment for panic disorder then is to address this worry circuit, this negative cycle of panic disorder. And the way to address this is through psychotherapy. So cognitive behavioral therapy, also known as CBT, is a first-line treatment for panic disorder. However, it is difficult to treat panic disorder with psychotherapy alone, at least initially, because the CBT only addresses the avoidance and the anticipatory anxiety, but it does not really address the unexpected panic attacks that's occurring, because it's the CBT is not addressing the fear circuit, the malfunction in the fear circuit. The CBT is only addressing the avoidance and anticipatory anxiety. So you need a combination treatment. So the CBT addresses the malfunctioning worry circuits. However, you need another treatment that addresses the malfunctioning fear circuits. So to address the malfunctioning fear circuits, to address the unexpected panic attacks associated with the malfunctioning fear circuits, people may need pharmacotherapy. So prescription drug treatment for panic disorder is oftentimes necessary, as panic attacks are occurring spontaneously. So medications that are effective for panic disorder include selective serotonin reuptake inhibitors, also known as SSRIs. However, SSRIs take a few weeks in order to kick in, and sometimes SSRIs can be activating in that it might actually increase anxiety at first and agitation at first. So while the SSRIs are coming on board, when you are first taking an SSRI, sometimes your doctor will prescribe you a benzodiazepine, so that the benzodiazepine can work immediately to decrease your panic attacks until your SSRI becomes effective weeks later. I want to emphasize that taking benzodiazepines is not a long-term solution. It's only a short-term solution until your SSRI becomes effective weeks later. So let's say your SSRI starts to become effective 2 to 3 weeks after you start taking it. Then at that time your doctor may start to taper and discontinue your benzodiazepine. So at most you'll be on your benzodiazepine for a few weeks, then it's discontinued. The problems with benzodiazepines is that it's highly addictive, so it's not a good idea to continue it for more than a few weeks. And of course, if you have a substance abuse problem, then benzodiazepines are contraindicated in that case. There are alternative panic disorder treatments such as exercise, progressive muscle relaxation, diaphragmatic breathing, meditation, yoga, tai chi, massage, martial arts. However, I want to emphasize that these are meant to augment your primary treatments for panic disorder. So the primary treatments for panic disorder, if you have bona fide panic disorder and you're having severe panic attacks which are severely impacting your functioning, then the best treatment choice would be to go to your doctor to start treatments with cognitive behavioral therapy and prescription medication treatments. So these alternative panic disorder treatments are meant to augment those primary treatments. So, exercise, progressive muscle relaxation, meditation, yoga, these are good to get your overall stress levels down, so that your anxiety levels could come down to the point where it's actually helping your primary treatments. Other alternative panic disorder treatments include natural supplements. Now, there are some people that absolutely do not want to take prescription medication drugs, as they're expensive and they also have a lot of side effects. Well, there are multiple studies showing several different natural supplements are effective and safe for anxiety disorders such as panic disorder. And as I said before, natural supplements generally have fewer side effects and are generally less expensive than prescription medications for anxiety. So for people that don't want to take prescription medications for panic disorder, then you may consider natural anxiety supplements, as these have preliminary evidence that they are safe and effective. However, if you have severe panic disorder, I would recommend that you go to your doctor and consider taking prescription medication treatments with CBT, as these are proven to work. So these alternative treatments, such as natural supplements, are only for more milder cases of panic disorder, and also if you absolutely do not want to take prescription drugs for anxiety. So other panic disorder treatments include self-help. So there is preliminary research that has shown that self-help interventions are effective for panic disorder and other anxiety disorders. So self-help interventions are convenient, can be done in your own time, do not require a doctor visit, do not require a therapist visit, and are relatively inexpensive. However, if you have severe panic disorder, which is severely impacting your functioning, then I still would recommend that you go to your doctor to consider CBT and prescription drug treatment. So self-help treatments are mainly for people that have milder symptoms of panic disorder and or who have gone through a successful course of treatment and their panic disorder is under control, and then you could use the self-help then to maintain the gains that you learned in treatment. So it's to help you so that you don't get future relapses of your panic disorder. So to summarize, panic disorder is characterized by recurrent panic attacks and anticipatory anxiety. Panic disorder is best treated with combination treatment with CBT and prescription medications. Alternative treatments such as exercise, progressive muscle relaxation, diaphragmatic breathing, natural supplements, and self-help have preliminary evidence that they are both effective and safe for anxiety disorders such as panic disorder. However, as I mentioned previously, these alternative treatments are meant to augment the primary treatments for panic disorder, which are CBT and prescription medications. You especially want to consider CBT and prescription medications if you have more severe forms of panic disorder. Now, you could go to alternative treatments if your panic disorder symptoms are mild, or if you have successfully completed a course of treatment for panic disorder and you have recovered from panic disorder, then you can use the alternative treatments to help you continue to recover from your panic disorder so that you don't get a relapse of symptoms. So that concludes my presentation on panic disorder. But please visit AnxietyBoss.com to learn more about panic disorder and other anxiety problems. I'm Dr. Carlo Carandang. Thank you for viewing.